Thanks, Suzanne, and welcome everyone to today's discussion. On Saturday, as you know, 2 Air Force medical teams arrived at Strong Memorial Hospital to provide support for our clinical operations here. These were deployed as part of the Defense Department's ongoing COVID response operations that support FEMA and New York State. Similar teams have been deployed to Syracuse, Buffalo, and downstate. We are exceptionally grateful, as I know that Kathy Peronello will talk about, for their service and sacrifice, and their presence here as a welcome relief to our clinical staff. We know the media have lots of questions about this, and we are so delighted to be joined today by Kathy Peronello, our Executive Vice President and Chief Operating Officer for Strong, and Lieutenant Colonel Alan Delgado, who is a U.S. Air Force Family and Aerospace Medicine nurse practitioner, and also one of the officers in charge that's kind of leading the effort for the teams here. With that, Kathy, I'll ask if you'd like to make an opening statement.
Sure. Thanks, Chip. And as you all know, these last 2 years have been challenging for our clinical team. Our people have worked extremely hard to maintain the service during this pandemic. They've dealt with staff shortages, multiple cases of COVID, and so much more. They're caring for more patients today than ever before, working overtime and taking extra shift and responsibilities. I couldn't be prouder of the work that our team has done to better serve our community and all of the people that rely on us for care. I want to express my gratitude to Lieutenant Colonel Alan Delgado, who joins me here today, and the entire Air Force medical team on behalf of everyone here at Strong, the community and the patients that we take care of. Your team's arrival couldn't have come at a better time. Our staff has worked and done a yeoman's job taking care of patients, but they're tired, and your help has brought a real boost to everyone's morale. I want to thank you and your team for your service and your sacrifice. We recognize you are leaving friends and families in other parts of the country to come here and work at Strong. And many of you come from much warmer climates in Nevada, Arizona, New Mexico, and Alabama. So we really appreciate you weathering the cold weather here in Rochester. We've certainly learned a lot of military terminology in the last several days, but I can report that as of today, our team, after a few days of onboarding, is fully operational here at Strong. Over the next 30 days, the airmen, including Lieutenant Colonel Alan Delgado, will become part of our family and work shoulder to shoulder with our teams taking care of patients. We're really excited to have you here. You and your teams are going to play an important role in helping us serve our community. Finally, in addition to FEMA and the Defense Department, I want to express our gratitude for Senator Chuck Schumer and our Governor Kathy Hochul and our delegations in Washington and Albany, who requested these military medical teams on our behalf and have provided critical relief for our community and for our staff. So thank you very much, Alan and team, for being here. We're really excited to have you here.
Thanks, Kathy. And Colonel Delgado, do you want to make an opening comment?
Yes, I'm Lieutenant Colonel Alan Delgado. I'm the officer in charge for one of the military medical response teams here at Strong Memorial. We are here in support of FEMA at the request of the state of New York to assist the medical staff with the stress the latest surge COVID-19 has put on the healthcare system. There are approximately 40 Air Force military medical personnel on the ground here at Strong Memorial from various military bases from states that include Arizona, Nevada, Texas, Mississippi, and New Mexico. Our team consists of military physicians, nurses, medics, and respiratory therapists, and a command support staff who bring with them an abundance of medical experience and knowledge. Their expertise, coupled with that of the Strong Memorial Hospital staff, will help tackle the continued need for access to medical care within the local community by increasing hospital capacity. Since our recent arrival, the Strong Memorial staff have gone above and beyond to ensure that a seamless integration of our service members into the hospital team. This includes credentialing, training, and orientation, all in just a few days. And for that, we are extremely grateful. We remain committed to supporting the community of Rochester as we work to help relieve the pressure on the healthcare workers overwhelmed by the coronavirus pandemic. The duration of our support here will be determined as the situation evolves. but our team of highly qualified military medical professionals will remain committed to the mission as long as needed. Thank you so much for having us here. We are honored to be here in support of Strong Memorial Hospital and the citizens it serves.
Thank you, Colonel Delgado. And with that, we'll open it up for questions. And Wendy Wright from Spectrum News, I think you're first.
Yes, hi there. Well, welcome to Rochester, Lieutenant Colonel.
Thank you, ma'am.
Nice to have you here. I'm sure all the folks here are happy to have you and all of your colleagues here. So I know you guys are coming from all over. Do you mind saying where you're coming from? What state?
I'm coming from Nevada, ma'am.
Okay, so you are a little bit far from home. What's your training and what are you specifically doing while you're in town here at Strong?
So I'm a family nurse practitioner and an aerospace medicine nurse practitioner by training. Right now, I'm kind of dual-hatted as the officer in charge. So, ensuring mission success while we're here, but as well using my training that I have here in whatever capacity Strong needs me to do to help with the patient population.
So specifically, have you interacted with patients, or like what have you done, like a little more specifically?
Yes, ma'am. I've been currently going through the internal medicine clinic here and seeing the patients that are coming through, working alongside the staff. So a primary care setting.
Do you have any idea how long you'll be staying? Is there a specific time period?
So we're continuing to monitor the situation, projected possibly around 1 month, but again, depending on what as we evaluate the situation, if it evolves, we'll adjust as we need to.
Wendy, I need to jump in. I'm sorry. I think I gave you an extra follow-up or two there. So we need to move along, please. Jennifer Lukey at WHEC 10.
Good afternoon. Lieutenant Colonel, I'm wondering if you could talk to us a little bit about what you're used to doing in this role and how this compares to what you're doing now. Just kind of what your medical background is and what kind is this. I'm assuming this is a much different setting than you're used to.
So patient population wise, instead of having a lot more active duty, we still do see dependent care as well. We still got our war fighters, past and present, that we still take care of. So, comorbidities are very similar. So, we're still, medicine's still medicine. It's just more so learning the intricacies of this healthcare system and, learning their electronic medical record and just making sure it's a seamless process. But again, the Strong Memorial staff has been great at helping us transition very easily.
What I'll just add to that is the team has been so flexible. We're a big organization, so we're able to place this military team in areas that we can then often move staff around to cover other types of patients. So having the clinicians, the physicians, nurse practitioners, and registered nurses here has been a big boost because it's created added flexibility for us as to how we carry out our assignments.
And Kathy, I have a kind of a two-part double or follow-up question for you about that. Can you kind of tell us what capacity is like now? We are on the other side of the COVID surge. We've talked about this before, but we also have the booster mandate coming up. And I'm wondering how that might affect your staffing. Do you have any specific information on how many employees you could lose if they don't get that booster by Monday?
Well, I'll say, first of all, that the majority of our staff are boosted. And we are still analyzing all our data because recall, many individuals are not yet eligible for booster because it depends on when you received your second dose of your primary series. Also, individuals that have had COVID, often for medical reasons, will wait up to 90 days. So we're still aggregating all of that information. Again, unlike the other deadline where you had to have a first dose by a certain date, February 21st, not everyone will be eligible and may have temporary exemptions due to having COVID. So the date isn't as hard and fast as certainly we experienced last fall.
And just what's capacity like right now? And are these folks in this team, they are not necessarily just focused on, are they there more as relief for your overstressed staff, or are they there to expand capacity?
A little bit of both. Our census continues to be really high, even though the COVID number of patients has gone down. Recall that when the COVID census was really high, we had to defer a lot of care. So there are many people that had their surgeries delayed that are now trying to get their surgeries done. Other medical ailments that had to not get treated immediately. So we're finding that some of this backlog in patient need is creating continued high census. We're licensed for 866 beds. We frequently have over 900 patients. So this medical military team is enormously helpful in helping us continue to keep all of our beds open so we can take care of patients. And you might also recall that the nursing home industry is quite challenged as well due to staffing. And so many of the hospitals in New York State continue to have many patients that would otherwise be placed in nursing homes still requiring care in the hospital. This team has been very helpful in working in that unit, where we've cohorted a number of patients that are already medically not as acute anymore, but still have to receive care in the hospital. So we're grateful for the team's effort on that unit, as well as a couple of other units.
Thanks, Kathy and Jennifer. And now Raquel Stephen at WXXI.
Oh, Jennifer took all the good questions again. I guess for Lieutenant Colonel Delgado, can you just take us through your day, your typical days right now within the hospital system? What are you doing when you wake up, and how are you transitioning? Can you take us through your day?
So my days are a little bit different, say, than the rest of the team. So because I am the officer in charge, so my days does involve a lot of briefing, a lot of updates. And then I transition over to the clinic, where I help see some of the patients there that are coming through the front door, those primary care and acute care needs. But we do have staff here that they're side by side taking shifts along with the team of physicians and nurses in the inpatient floors here. So their days are a little bit different, just as very similar to one of the organic staff that's here.
And I'm just piggybacking off what Jennifer said, with the case numbers going down, do we anticipate a situation where the military staff won't be needed for 30 days, or is there a situation where the extension could be made?
Well, as I mentioned, even though the COVID numbers are going down, the number of patients requiring hospitalization isn't going down. And as Lieutenant Colonel suggested, that they will make an assessment with us. Their first mission is 30 days. They will make an assessment with us as to any extension. But at this point, the mission is 30 days, as I understand it, right, Lieutenant Colonel?
Yes, ma'am.
Thanks, Raquel. Is there a reporter on from 13 WAM?
Hi, everyone. Can you hear me?
We can.
This is Natalie Kutchko. Thank you for your time, everybody. My first question, I think, is for Kathy. You touched on this in the beginning, just on the reaction overall from current staff at Strong. How much of a weight of this is lifted now that these teams are here, and what's the general consensus from staff?
Well, I think it's been a morale booster for sure, because these folks that have come from long and far have been delightful and have engaged with our staff, and it's been a real morale booster having roughly 40 extra people in our organization. And like I said, there's 3 units in particular that they are spending time on, and these are units where the needs were great and the staff shortages were the greatest. So I would say overall, staff are really excited to see them.
Thank you. And then just to piggyback off the most recent question about hospitalizations, it sounds like the need for these teams could very well exist, past the 30 days.
Well, that's to be determined. We continue to avidly and actively recruit. new staff. We have a number of people, particularly nurses that graduated in December, that will be starting or have started and are in orientation. So we continue to try to shore up our numbers of staff that we have, and we'll evaluate over time with our military partners what the need will be.
Thank you, Natalie. Amal from WROC TV.
So me and my team, we've been good. We've been very motivated. We're constantly training at our home station. So I mean, COVID is everywhere. We've seen and treated it at our home stations. Coming here, just a little bit different. Again, healthcare system that we're kind of getting integrated to. So that again, we're learning that. But overall, it's been very similar.
You have a follow-up, Amal? I think you might be muted. Oh. Okay, thanks very much. Will Astor from Rochester Beacon. Welcome, Will.
Hey there, Chip, Kathy.
I will.
So I guess my first question would be for both Kathy and Colonel Delgado. Could you say a little more about the process for how you'll decide and evaluate whether the military personnel stay is extended?
Well, I think that's a broader decision, Will, and frankly, this is the first time we've had a military medical team here, so I'm not quite sure how that works, and I'm sure FEMA has other needs across the country that they have to address as well. So we are really focusing on the next 30 days. And I think, of course, at Strong, we continue to monitor our staffing and all sorts of strategies to meet the needs of patients. But we're really focused on these next 30 days with our team led by Lieutenant Colonel Delgado.
Does that cover it from your side of the equation, Colonel?
Yes, sir. So like she had mentioned, we do evaluate this stuff, and again, we do report those as well to up our chain as well, and then it's a collaborative decision that is made on the decision on an end of mission time frame.
So is it the nature of that you evaluate the information that you get, what you see on the ground, and what Strong personnel say, and you report back to your superiors, to FEMA, and then can you make the decision, or is that above your head?
No, that's actually a hospital decision. Our job is just to kind of report
It's the hospital
what we're
decision.
doing here. Yes.
Yeah. Okay. And Kathy, you talked a little bit about the continuing staff challenges that you face, which to some extent predate, but have been greatly exacerbated by COVID. Can you say how the measures that you mentioned before are working? Have you seen notable improvement? I believe that unit that you mentioned for the long-term care was initially hoped to be only needed for a couple of weeks, and it's apparently still in operation. So how's it going?
Yeah, it's a complex, that's a very complex question, because of course we aren't the only hospital or healthcare facility experiencing shortages, and much of our census of patients relates to what others can handle. So the nursing home is a good example. We have been working diligently with many nursing homes throughout the region, and we do get patients discharged every day to nursing homes, but of course, given critical needs, there are more patients coming in that end up needing nursing home placement before they are able to be discharged. So we'll have to see how that shakes out over the next couple of weeks in terms of our ability to close that unit and get everybody back to nursing homes. I think, as I mentioned before, I think the demand for healthcare services is just as great now as it was during the COVID surge, again, because people defer care and didn't have either surgeries completed or other procedures done that had to be deferred during the COVID surge that are now trying to get back and have those procedures and surgical cases done. So I think we'll be quite busy for a while.
Okay, I just want to clarify one thing, not trying to get another question. I just want to make sure I understood Lieutenant Colonel Delgado, that it's up to the hospital whether you stay longer or not. Did you mean to say that?
Yes, sir.
Okay.
Yeah, I think it's the hospital that would request, just like we did originally. But I think then it's ultimately up to FEMA to determine if there are more pressing requests out there than ours.
Okay, so your word may not be final, but
Yeah, that's my understanding, Will, is that there are many things that FEMA has to consider.
okay.
Yes.
And before we wrap up, Kathy, I've gotten a question in the chat of whether these military medical teams will help with ED backup at all and ED wait times and elective surgeries and our ability to perform those at full capacity.
Sure, and as you all know, ED backup occurs because we don't have beds to put patients in. So to the extent these teams help us keep beds open, then absolutely will help with ED backup, as well as then being able to get surgical cases in who need hospital beds as well.
Thank you. And I'll ask a final question of Lieutenant Colonel Delgado. I know you haven't been able to. Has anyone on your team been able to enjoy a garbage plate yet, or any of our other fine Rochester delicacies?
I have not. Our team is still getting used to the area, but I've been told by many locals that is a must. So I am looking forward to my first garbage plate.
And we have provided our military friends with all sorts of must-do things while they're in Rochester.
And I'm sorry, I'm getting one more question in the chat. We still aren't at a half hour. Lieutenant Colonel Delgado, have the medical teams been to other hospitals during COVID?
So there's various teams that go out across the country, based off the need. There are other local news areas probably have reported that that they've seen our presence there. But yes.
Yeah, and Chuck, Chip, as you said, there are teams now in Buffalo and Syracuse.
Well, I want to thank everyone for being here today, from the media, helping us put out the good news about this deployment, for which we're very grateful. Especially want to thank Kathy Perinello and Lieutenant Colonel Alan Delgado for taking the time to answer questions. I should note that the link that went out with our news release